See, because pain is there, it's only 1 month, right? Surgery we'll have to take a scan and see. Or ideally, don't do anything, just wait. Because the bone surgery it will take some time for the bone to heal.
But just to make sure.
Then we'll take a scan. I cannot. You want to be sure there's nothing happening wrong inside? Nothing is happening wrong. Nothing is happening.
Because if I talk too much, my left side is paining. And the pain is coming occasionally, like not all the time, but it
once
is.
in a while.
And if the pain comes, it radiates to the TMJ joint, then it's paining.
Oh, that is in the joint. Okay, open a little bit. Okay, bite.
Okay, when I open, I can feel the pain.
On that side also. Okay, right. Look, that is because you're in the medical field. I'll tell you what is happening. The jaws are like this. We have done jaw surgery. What I have done, I've cut the jaw, I've moved it forwards, downwards, and I've fixed it with plates and screws. Now, remember, the muscles have to attach. Muscles make you open the mouth. Inside you're showing that hand. That is where the muscles attach on the genium. Here, if you see, muscles are attached here. I detach those muscles with the bone and pull it forward. So the muscles take some time for healing. It is not healed for you. That is why when you open and close, you are feeling some pressure and pain. Second, here also same thing, because we've done some angle work there. Muscles have to reattach. So it's a muscle issue.
And here also the pain.
Yeah. It's all related to muscles from your complaints. So it will become alright within some more time.
Okay. How about this?
Oh, this side? Looking beautiful.
Also, I can feel this side of the lips is drooping.
A little bit maybe. See, again, that's because it's too early days. When did we do the surgery now? 1 minute.
July 2nd.
July 2nd. Today is August 3rd. So 1 month only, na? Take time, Baba. It's too early.
Does this drooping go away or it remains forever?
So I think all the muscle attachment, you give it another 2 months and it should disappear. Everything should become normal for you. Remember, I don't know if I've told you, but before you start surgery, you feel your jaws and your face in one level of comfort, right? It will take maybe 3 months. Some patients even tell me it has taken 5 months, 6 months, like that, to feel that same level of comfort. Now, when I look at you now, I can still see little swelling here and here, but if you go on the street, they will not know anything wrong with your face. But there is something happening inside. You have a tightness in the some
also, when I wake up in the morning, I can see the swelling on this side. Like
a little bit more than that. It's all because of the healing.
Pain on this side is good.
Okay.
Nothing I can feel. It feels normal.
For the left side, you feel it a bit. Yeah, I mean, just because you're in the medical field, and just because you've come for a consultation, and just because you want to rule out, we'll take a scan.
Because one side, if it's happening, then it should
Why
be
not?
both sides.
So we'll take a scan, just so that even I also know what's happening. We'll check if the plates and screws are okay, because rendu side we put plates and screws. It doesn't look like anything is wrong, but I mean, we just take a scan and make sure everything is fine. Sharia. So we'll take inka scan, Lelina. So, and one more thing, thanks for sending your pictures. Many patients don't send us pictures because you did a very nice, cute before after. Where is that? Yeah. And here also you can see there's a little bit more swelling. I do agree.
My father was always complaining to me.
Has he come today?
No. My kids are with me.
Really?
Yeah.
Call them.
They are sitting here.
Call them. No, we want to see them. Call them. Come. Hi, come. You've got your brother?
Yes,
Where's he?
he's coming.
He's coming slowly. Hi, come. One more. Sit. So how's your mom looking now?
He's good.
She's good? Oh, very good.
Very good.
Very good. Awesome. Thank you. So what all changes do you find now? Can you tell me?
Well, the chin is longer.
Chin is longer and
Her lips in a different part of her face.
okay. Good observation. Hold this. Okay. And then? You like her better now after surgery or before?
Both.
You like her now? Wow.
Both.
You like both? Okay, because it's a shame, mom. Is she happy with the surgery?
Yeah.
She's also happy with the surgery?
Yeah.
When do you guys all go back?
September 20.
Oh, so you have a long break.
Yes.
Yes. So we just did a procedure on your mama here. You know that, right?
Yes.
Because I didn't see you both when she came for surgery. She came with her mom, with her dad.
Yes.
Yeah? Right. So you're happy that she got the surgery done?
Kind
She's
of.
very sure. She's thinking. Which grade are you studying now?
Going into grade 6.
And you?
Going into grade 4.
4. Nice. Alright, so what we're going to do with your mom now is, because she has some little pain on one side, we're going to take a scan. It's probably going to take 20 more minutes and then you guys are good to leave. Cool? Alright.
Also, I have one more concern. Few teeth on the left side is painful. Teeth.
Which teeth? Last or front?
Not last, somewhere middle, like after premolar, I guess.
Come.
Because I don't have premolar, it was expected for orthodontic treatment years back.
Let me check that. Maybe you had some pre-existing condition. This one is not very clear.
Yes, the second time when they took the scan, it was shaped.
Correct. Yeah, I'm not able to find that clarity. Let me check here. We will take one now. I think you're perfectly right on that because yeah, you've moved or they have not taken a proper one. I won't be able to appreciate on this one. Let's just take another one, Sujata.
Yeah, that's what I said.
And this is also looking a little bit bent. We will take another scan. Let's just take it immediately. So no wonder you've been wanting to take another scan. Hey, सुनो, इनका scan निकालना है कि जो अभी निकालो फटाफट. All right, go with her. We take a scan. Huh?
Thank you.
You are welcome.